Asthma is an inflammatory disease of what we call the lower airways, where the air tubes get tight and there's often some inflammation in the chest. And those findings can cause symptoms of coughing or wheezing or shortness of breath. And we often see asthma in allergic kids. Asthma is diagnosed on testing, and we use breathing tests to diagnose asthma. So you can imagine that it's difficult to diagnose asthma in very young children. So when we're dealing with very young children, we often rely on the story and the symptoms and what's going on to diagnose asthma. We often don't diagnose asthma before age 3 unless it's pretty obvious. Kids under age 3 frequently wheeze, and some of those kids don't go on to develop asthma. And some kids, or I guess some predictors of who would go on to develop asthma would be kids who wheeze when they're not sick, or kids who have a parent with asthma, kids with significant eczema, or kids with positive tests on an allergy test. So those kids are more likely to go on to develop asthma. Not just one of those things, but if you look at all of them, it feeds into something we call the Asthma Predictive Index. But those are markers of kids who are more likely to go on to develop asthma. And the other thing I would say is that a lot of parents, they get a little skittish when we talk about asthma. When I come into the room and we start talking about asthma, everybody gets nervous and they don't want to hear it and they don't want to talk about it, and that's understandable. But you have to remember, asthma is a broad disease, and I have a lot of patients with asthma. Very few of them are quite sick. Most of them have a very mild asthma, and it's a whole spectrum of different findings. So if we think it's asthma, it's important to recognize it so we can treat it appropriately and keep the kids healthy.
So that's great. As an allergist, you can treat allergies, asthma, and eczema, right?
Definitely. Absolutely.
That's terrific. Do most kids outgrow asthma?
A lot of kids do. A lot of kids outgrow asthma. I see a lot of adults that say, well, I had asthma when I was in high school, or I used to wheeze when I would do sports in grade school, and it just doesn't happen anymore. So asthma changes. I have patients, adults and kids, who have had severe asthma in the past, and it's just for whatever reason been calmer lately, maybe because the things that trigger them aren't as common. And folks with asthma have all kind of different triggers. Sometimes it's allergies, sometimes it's exercise or infections, or heat or cold or irritants or all sorts of things like that.